Welcome back. Now, in the month of March, we observe Kidney Month, and today is World Kidney Day. A chronic kidney disease continues to affect people of all ages, including children. And globally, it is estimated that 1 in 10 people are affected by this condition. Kidney disease in children ranges from lifelong threatening conditions to other non-threatening treatable disorders. And also, there is a significant backlog for kidney transplants, leaving a strain on those who have to undergo dialysis. So to discuss this further, we have Dr Tholang Khumalo, who is a pediatric nephrologist at the Nelson Mandela Children's Hospital. Thanks so much for your time and welcome to Morning Live.
Thank you so much. Thanks for having me.
I had so many questions running through my mind, just thinking about children and kidney disease. But let's just start off by quantifying how severe is this problem in South Africa?
So with respect to children specifically, fortunately, the number of children with chronic kidney disease who end up with end-stage renal failure is less in children. We're looking at about 10% of what the adult population is suffering through. However, with children, it's still quite a big number of them end up with a broad range of disorders in kidney diseases. Like you said, the treatable ones, the urinary tract infections and congenital abnormalities that we're sometimes able to work with. But the numbers are quite big.
Now, when one thinks of kidney disease and things like kidney failure, perhaps, wrongfully so, you imagine this to be something that adults will deal with. But you, of course, specialize on the pediatric side of things. And one of the questions that immediately came to mind last night when I looked at this was, when you do a kidney transplant, for example, does size matter?
So size definitely does matter, Sakina. What happens is if the child is very small, we're unable to give them an adult kidney sometimes. We do tend to wait for children to grow until they're about 10 kilograms or at least look big enough to be able to take the kidney. The other problem becomes if it's a cadaver kidney. So we have two ways of transplanting. We have live-in donation, and that's when you get a kidney from your parent. That is usually a planned procedure. So because we're able to plan it, we're able to map out exactly what size kidney, if it's the appropriate time to do the operation according to the size of the child. But if you're looking at a cadaver kidney, which we get then from the organ donation, we don't really have that luxury all of that much. But we do know that children do end up having the adult kidneys, and they do quite well. It is definitely much better than being on dialysis.
So we often hear that the waiting lists are quite long, sometimes so long that, people's lives are literally threatened. Is there a separate list for children waiting, or do they go onto the same waiting list as adults?
So we're all on the same waiting list with the adults. The scoring system is different though, and sometimes children fortunately do end up being a little bit higher on the list than the adults. So that does sort of help us. But overall, generally for both adults and children, the waiting time is very long. In other places, in first world countries, you're looking at children only being on dialysis for a year before they're able to get a kidney. In our setting, you're looking at maybe 6 years before a child is able to get a transplant on the cadaver list.
Dr. Khumalo, the Nelson Mandela Children's Hospital, one of only 2 dedicated children's hospitals. So does that mean that there is a limit to access? Does that make access to treatment difficult for children?
Very much so. There aren't that many pediatric nephrologists around in the country, and even as we're all in like centralized areas, even for both state and in private practice. As such, a lot of that goes on in the more urban areas, like you mentioned. There's only 2 children's hospitals now, and then there are a couple of other centers, but most are in Gauteng. This obviously becomes an issue for children who are living out in the outskirts of Limpopo. We do have patients who come from that far, and fortunately we work in collaboration with the hospitals that are there to be able to bring the patients back and forth as we need. I think we've got patients for as far as 400 kilometers away who are on dialysis, because you have to be able to treat the children, and if the family is able and willing to do the dialysis, then there's no reason why you should make distance be a limiting factor. That's just one of the things that we believe.
So often, we're told prevention is better than cure. But how do you keep your kidneys healthy?
I'm glad you actually asked that, because this year we're actually looking at prevention as a theme for World Kidney Day. And if you look at prevention, you have to try and prevent yourself from getting chronic kidney diseases. So it's simple things: healthy lifestyle, low salt diet, lots of water, exercise, the basic things, no smoking, try and combat obesity. Then of course, once you have kidney disease, it's about making sure that you have referred to a specialist center where we can try and preserve the amount of kidney function you have left. So that's another gambit of prevention. And of course, if you're hypertensive, you're diabetic, being compliant to your medication will also help you prolong the life of the kidney that you have.
So you say drink a lot of water, but in terms of what to eat, are there any sort of foodstuffs that are more beneficial for your kidneys?
Generally, I just want people to be able to eat a healthy, balanced and a variable diet, just to be more cognizant of salt intake. I think as a community, we're taking in a lot more salt than what we should be, more than what we actually realize we are.
And also important, I suppose, is to understand that not all kidney problems are terminal. But can you just, expand on that for us?
So obviously there are kidney diseases that are curable. We have things like minimal change disease, a sort of nephrotic syndrome, where the children will come in with swelling. And sometimes these kids never have the disease again. They come in with swelling, we treat them once, and then we eventually discharge them from our clinics. Those are the kind of, patients that we don't get to see. Some children have a urinary tract infection. They may have 2 or 3, and then we'll eventually just stop having them just from either our surgical intervention with the surgeons or just with growth and time.
And with regard to signs and symptoms, what could parents be on the lookout for? Especially as you say, sometimes you're in far-flung areas. What are some of the signs and symptoms that children present with?
That's the other thing about kidney diseases. It's actually like a little bit tricky to pick up, especially in the early stages. But things like maybe swelling, changes in color of the urine, swelling of the legs and the feet and the face, changes in the color of the urine, not growing well. That's a big one with children. Children end up not growing. They're like stunted, so they're shorter and they weigh less than their peers. And just lethargy and poor concentration. But as you can hear, those could be a lot of other diseases. So it's quite difficult for you to be able to pick up immediately. But urinary tract infections, so kidney infections, bladder infections, those ones actually point us towards kids who could potentially have other kidney problems.
And how do you go about actually encouraging people to become donors? Is it something that you encourage? Because very often there are cultural considerations and people concerned that this may be detrimental to their own health should they opt to actually donate a kidney.
Yes, of course. Well, across the country and actually worldwide, everybody's always trying to educate the public about organ donation. Organ Donor Fund South Africa does a lot of not just educating the community, but also educating doctors to be able to know quite easily that, okay, this patient is actually a candidate for donation, and to call the Organ Donor Fund in so that they can talk to the family and get the process going, and really just educating the family. The public. It becomes easier if the family can see a child suffering with chronic renal failure. Then it becomes easier for them to understand because they can see it. But it is quite difficult, especially battling the cultural problems, the cultural issues that you mentioned.
And can children become donors to siblings?
We do not take liver donation according to the country's legislation. We do not accept liver donation below the age of 18 years. It's quite a big step to be able to live without a kidney, and you have to be able to consent for it yourself. So we want maturity also. But cadaver kidneys, so babies and children who are maybe brain dead can offer their kidneys and the other body organs for organ donation. So we do definitely get from children who are cadavers, but not from living donation, no.
Well, Dr. Khumalo, thanks so much for your time this morning. Certainly been very interesting and very educational. Dr. Tholang Khumalo is a pediatric nephrologist at the Nelson Mandela Children's Hospital, talking to us about kidney disease. It is World Kidney Day today.